All right, guys, welcome back to Medical Mondays with Manny. Today, we're going to talk about how to run an AED. So in the last week's video, we talked about how to do CPR. Now we're going to learn to incorporate an AED into the process. So AED stands for Automated External Defibrillator. The purpose of this device is to not shock the heart back into rhythm, but rather to stop it so that the heart's sinoatrial node, otherwise known as the SA node, can reset itself and get the heart back into normal sinus rhythm. So in the event of somebody who is suffering cardiac arrest, is undergoing CPR, a second risk here will come in with an AED and apply the pads as CPR is being done. So the way to do this is to open up your AED, and you have the unit itself and you have the two pads. Keep in mind that each pad has a designated location. So you have one pad that goes up on the top right side of the chest. The next pad goes on the lower left side of the chest, just right below the heart. So what you want to do is you first want to power on your AED and it'll start giving you instructions. So by doing that, you just press the green button.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Press pads firmly on skin. Apply pads as shown in the pictures. Do not touch the patient. Analyzing heart rhythm.
At this point, we stop CPR.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button. Shock delivered. Begin CPR.
And there you have it. So after the AED has shocked your victim, you want to continue doing CPR and continue to listen to the instructions as the AED gives them to you. It is a very simple device to use for the most part. Just listen to the instructions and you'll be successful. Make sure that you are not touching the victim when the shock is delivered, and likewise you also want to make sure you're not touching the victim while the AED is analyzing, as the AED can pick this up and it'll confuse the unit and it'll think that it is having an abnormal electrical rhythm. So make sure that we keep our hands clear as the unit is analyzing and before we shock. Also, you want to make sure that your victim's chest is clear. So make sure that if it is wet, you want to dry it off with the rag as quick as possible. It doesn't have to be perfectly dry, but dry enough. Next, you also want to make sure that if your victim has a hairy chest, you can use the razor that comes with an AED or with most AEDs out in the field. Or if your AED has a second set of pads, you can use the first set of pads to yank off the hairs. And also you want to make sure that if there is a medication patch on the patient's chest, that you remove this patch. Otherwise, if the patch has nitroglycerin, this can severely injure the victim after a shock is delivered, as nitroglycerin is an explosive, but it is also used to treat chest pain. Otherwise, make sure you remain calm and that you do good quality chest compressions and that you listen to the instructions of the AED as it gives them to you. Other than that, that is pretty much it. And you're going to be doing this until responders show up, which, it could vary depending on where your location is at. But the quicker you call, the sooner they will get here. And that is it.